Dear students, in this video, I shall be discussing about the investigations to be carried out for retropharyngeal space abscess. As you know, when the patient has abscess in the body, there may be septicemia. The first investigations to be carried out is complete blood count, which is helpful to diagnose leukocytosis or septicemia. When total leukocyte count goes very high and neutrophils are more, then we have to think of septicemia. The next conventional investigation will be plain X-ray, soft tissue neck lateral view, which is the most commonly performed radiological investigation for retropharyngeal space abscess. When we look at the level of C2, the distance from the anterior border of the cervical vertebrae to the posterior border of airway should be less than 7 mm, regardless of the patient's age. And at C6, it should be less than 14 mm in children younger than 15 years old and up to 22 mm in adults. This is the normal finding shown on the X-ray. Therefore, if the prevertebral soft tissue shadow is widened more than normal in all ages, or more than 2/3 of the corresponding cervical vertebral body, or presence of air fluid level in the X-ray signifies the retropharyngeal space abscess. You can see here in this X-ray air fluid level seen on the prevertebral soft tissue shadow. These are the vertebral bodies. This is the prevertebral soft tissue shadow, and this is the airway. The airway in this patient is compressed. You can see a small streak of airway here. But the most important investigation is the CT scan of neck, plain and contrast. That is very important, and that can show us the extent of infection or abscess and involvement of the other spaces. You can see here, this is the retropharyngeal space abscess, which is compressing upon the food passage and the airway on the left side. You can see the abscess here. This is the retropharyngeal space abscess. Therefore, CT scan is the most important investigation to be performed. Plain X-ray, soft tissue neck lateral view is the most commonly performed investigation for retropharyngeal space abscess. The most confirmatory diagnosis shall be aspiration of the pus from the retropharyngeal area. The X-rays cannot differentiate between blood and the pus, that is hematoma and abscess. Therefore, if you keep the patient at the edge of the table with the head hanging down, the pus will collect in the upper part of the neck, that is at the oropharyngeal area. Then if you look on the patient's throat, you can see a bulge in the postopharyngeal wall, and you can aspirate with the 18 gauge needle fitted in a 10 ml syringe. So if pus comes in the syringe, then that is 100% sure that patient is having retropharyngeal space abscess, and you can drain at the same time. You have to always drain, keeping the patient's neck in the drainage is always done with the patient's neck keeping at the edge of the table. Otherwise, the patient sometimes may aspirate the pus, and there may be aspiration pneumonia, or patient may die because of laryngeal spasm, and the abscess may rupture also. You need to have a good suction at the time of drainage, and you can suction out the pus also. Thank you. If you like my video, you can subscribe my channel, Dr. Krishna Koirala, for more videos like this. Thank you very much.